Tommy Atchinson is a World War II veteran of the U.S. Army and the Air Force and was stationed primarily in Guam during his many years of service. In 2002, Tommy was diagnosed with Lewy body dementia, a combination of Parkinson's and Alzheimer's disease. His wife Janice recalls a conversation with his physician.
He told me that I would probably be better off going to the VA since he was military because of the programs that they had there. So we went and signed up at the VA and just had really a very good experience with the VA.
The Atchinsons were initially enrolled in the VA's Home Health Attendant program, where Tommy qualified for the maximum amount of services.
They gave us a program where they came out 3 hours a day, 7 days a week for visiting angels to come help me with him. Well, 3 hours a day, 7 days a week is not much time for me to get out and do anything. You can't go to the grocery store from here in 3 hours. So it was really hard. I was just going downhill as much as he was because I just couldn't take care of him. And so it was either going to have to be put him in a nursing home or have full-time help, which I really couldn't afford.
Fortunately, when Janice was faced with this dilemma, the veteran-directed Home and Community-Based Services program was being launched in Central Texas under the direction of the local Area Agency on Aging. Through this program, Janice could serve as Tommy's representative and could make decisions based on her first-hand knowledge of his wants and desires.
Are you full now, honey? So when it all came about, VA called me, the social worker at VA, and asked me if I'd be interested in this program. And so I thought, well, why not? So when they explained it to me, it was just wonderful. So I said, what is the catch? Because it's too good of a program. And they said nothing, and so then that's when Tom Wilson and I got together.
This was actually the very first family we had enrolled in the program. They came to us through a community living program that was an Administration on Aging grant. And they were veterans, so they were the first ones we offered the program to. And you're already set up? With the funding we receive, our people can get between 40 and 50 hours a week, which means they basically have a full-time worker assisting them throughout the day, relieving their family caregivers to be able to go and maintain their jobs, maintain their own sanity, so they're healthy and well to care for those folks after hours when the workers are gone.
Based on his VD-HCBS assessment, Tommy qualified for the middle-tier budget for the Central Texas program. This allowed Janice the option of hiring workers for 40 to 45 hours a week.
I have at least 40 hours a week help that come in and help me take care of him. One comes in at 9 in the morning and stays till 3, and the other one comes in the afternoon if I need her, if I need to go somewhere or whatever. But that 9 to 3, 9 to 3, 6 hours a day, that gives me time to get out and do things. I can go to Bible study at church. I volunteer at the food bank twice a month, just to get out of the house and away. Ariana Juarez comes, she's been with me since we started. I interviewed probably 12 or 15 applicants. I put an ad in the paper, and Ariana was the one that I chose first. And she comes in every morning, and she's very dependable. She has wonderful rapport with Tommy. Susie has been a CNA for a long time, so she comes in and he likes her, and he's known Susie longer than he's known Ariana. But they're both just really good with him. Sherry Kell is my niece, and this is her Uncle Tommy, and she and Uncle Tommy get along really well. And if I have to go somewhere or do something, quick or whatever, I can call her and she can come over and interact with him.
Janice receives help managing the budget from a financial management services agency, which issues checks for her workers, handles the related employment tax filings and payments, and processes invoices for goods and services. Janice keeps track of her workers' hours and submits timesheets to the financial management agency, which then issues the checks.
I keep their time on the calendar in there, or they put it down for me. And then we do timesheets. I sign them and I fax them to Palco in Arkansas. And then they, in turn, do the checks. I have to put on the timesheets what program we're on and all of the information that they need, and then they, in turn, pay the girls. Both of them have direct deposits. So it's every other Friday they get their check right on time, and we've not had any problems.
VD-HCBS works in conjunction with other programs to provide participants with important services in addition to personal care.
I also have him on a hospice program with Vista Care, and they come Monday, Wednesday, and Friday and give him a bath. And they come, the nurse comes twice a week to check him, and the social worker comes about once a month. The chaplain comes probably twice a month. So they just keep me going, all of them together, and it's really working wonderful.
Janice was encouraged to use Tommy's VD-HCBS spending plan in creative ways and was able to buy important items that would ensure Tommy's safety.
Some of the things that we purchased through the program had been a GPS program that enables her, when he gets out of the house, to track him up to 5 miles away. He's a very fast mover and can get out of a house and walk down that street pretty quick, I've discovered. They've also used the funds to maintain the property, to keep him out of the hot Texas sun, wanting to do yard work and such.
There's locks on all the gates in the backyard, so he can go out the back door and go all over the yard. He loves outside. I think this program is wonderful. It's just changed, because he's at home with me all the time, and he's comfortable here. And I just think that it's the best thing for him.